you have a hospital bill, you can call and just say, hey, talk to the billing department. Hey, I've got this hospital bill. I was looking to close it out. I'm wondering, what is the settlement amount? And all that means is like, if I pay right now, how much will you take? Almost every single time I have ever done this, I have gotten 20 or 30% off the bill immediately. No questions. They'll just give you an amount that's lower.
Welcome to the Teacher Money Show, the podcast dedicated to helping teachers navigate your unique financial challenges and unlock your financial superpowers. I'm your host, Sean Morgan, a full-time educator and personal financial coach and speaker, and I'm here to help every teacher, whether you're a seasoned teacher looking for fresh insights or a new educator navigating your first paycheck, to have a richer wallet, classroom, and life. I'm super excited to have Jared Walker on the show today. Jared is the founder of $4, which is an organization that is focused on crushing as many medical bills as they can with charity care. It's a fantastic organization. I want to talk to Jared today about how we can handle our medical debts using some tips and tricks in that. And I'm super excited for this conversation. Jared, welcome to the show.
Thank you so much for having me. Appreciate it.
So, Jared, for teachers who might not know your work, can you just kind of share the basics, the beginnings? How did $4 begin, and what inspired you to take on the issue of medical debt?
Yeah, so I am in the Pacific Northwest, grew up in Portland, Oregon, and I started $4 originally as Dollar for Portland. So I, had my own experience with medical debt. So watched my family go through it and realized when you have a medical crisis, a lot of times you have a financial crisis. And I wanted to help people in that situation. So I started crowdfunding in Portland, Oregon to help people pay hospital bills. It was super grassroots, very Portland, like it was coffee shops, breweries, music venues, and I would host these small dollar events, and then I would pool the money together and pay hospital bills for people in our community. So I did that for years, and then I met who now is our director of policy, Eli, who is an attorney that told me about hospital charity care, and I had never heard of it. I'd never heard of hospital charity care, and basically, it is a federal law that requires hospitals, nonprofit hospitals specifically, which is most in America, to write off or reduce hospital bills for people within a certain income range. So if you meet these income requirements, the hospital has to write off or discount your hospital bills. I had spent years paying hospital bills for low-income families that would have been eligible for these programs through, crowdfunding. So I was not happy because I, felt like I'd wasted all this time and money, and was just frustrated. Like, how does nobody know about this? So I started digging into these policies, trying to, figure out, what is charity care? How do you get it? How do you apply? And I just started realizing how difficult it was. And most patients have no idea that it exists. So that is kind of what started it. I eventually posted a TikTok video in 2021 that went like super viral. And since 2021, we've eliminated over $120 million in medical debt for people and just helping them get charity care. So that's kind of the summary of, how it got started.
I love that. And, with you, like just telling people about charity care, like whether or not you actually go out and help people is something that can ripple beyond that. So I listened to another podcast where Jared was speaking about charity care, and then I was having a baby this year, and I looked into charity care, and I was like, "There's no way that I qualify for charity care, right?" And I applied, and we had 90% of our bill just written off. So it went from like 36,000 to like $3,000 or whatever for our
Wow.
baby. So I'm just letting you know that it's not just the people you help, but people hear the message who have never heard of this before. It's going beyond that.
I love it. Thank you so much for sharing. I did not know that. That's amazing. Yeah, it is. I mean, what you said exactly. Most people hear about it and they go, that's not for me. there's no way that I qualify. There's no, and it's like, hey, a lot of these hospital programs are more generous than people think. And it is not just as simple as like, oh, well, I don't qualify for SNAP benefits or food stamps or Medicaid. It's like typically the income thresholds are higher than what people think. And a lot of people are eligible for these programs. They just don't know.
Yeah, I love it. So why is it that we don't know about these things? What's making it such a hidden secret?
Yeah, I would say the hospitals, unfortunately. So, you know, this is a law that went into effect with the Affordable Care Act. So if you want to like really nerd out, it's section 501R of the Affordable Care Act, and it talks about hospital financial assistance, hospital charity care. You can use those terms interchangeably. So what it says is that the hospitals have to have these programs in order to keep their tax exempt status. So 65% of hospitals in America are tax exempt. They're nonprofit. And this is a part of the package. It's like, hey, in order for you to keep that, you have to provide community benefit. And charity care falls under community benefit. But what it says about the programs is that they have to be widely publicized and widely available. And that's all that it says. So, widely publicized for most hospitals is we put a poster up in the ER, right? Or we put some fine print on the back of your medical bill. So now it's widely publicized. So most people just leave the hospital. They don't read the poster in the ER because they're, in an emergency and they don't know about it. The other thing that happens is a lot of times hospitals really, really just push payment plans or pressure you to pay. So it's like there's no option. It doesn't seem like there's even an option for a program like this because it's like, hey, this is your final notice, pay up, pay up. So unfortunately, hospitals do a pretty poor job of telling people about the programs, and millions of people go on payment plans or even declare bankruptcy for bills that they actually don't have to pay. So that would be like, the simple answer is like, well, obviously the hospitals want you to pay up, so they're going to push that rather than telling you about charity care.
And like if I was in that position of running a hospital, like, do I want to have all the bills I send out come back for 90% less than the bill that I've sent out? Like, I can see why they're doing that, but it's also frustrating because of how high the bills are. And, people that are getting these huge bills that are never going to be able to pay it. So it's a tricky situation, but we want to be able to use this if we qualify, so that way we aren't in that situation where we have to declare bankruptcy. And that's what we want to talk about. It's just like, what do you do if you're in that situation? So let's say you fell and broke your leg and you went to the hospital and you had to stay there for a few days or whatever, and you get this ginormous medical bill. What is the first step that someone should take when they have this bill arrive?
So step number one, I always tell people charity care. Check to see if you're eligible for charity care. You can do that on your own, or you can go to dollar4.org. We have a free screening tool. So basically, what happened after our viral kind of moment in 2021 is we built a database of every single hospital in the country, all of their charity care policy and eligibility criteria. So you can go to dollar4.org. You can put in your household size, your income, what hospital, and it will tell you if you're eligible. So if you want to do it yourself, you can just Google, hospital name plus financial assistance, and it should pop up. But number one is like, see if you're eligible. There is, a lot of hospitals will go up to 300 or 400% of the federal poverty guidelines. So just like to put numbers to that, if you're a family of four, you can make about $100,000 or $120,000 gross annual income and still be eligible for something. So step one, charity care, always see if you're eligible. No harm in seeing if you're eligible. If you are not eligible, then you get into asking for an itemized bill, right? So you want to know, they say 80% of hospital bills or 80% of medical bills have billing errors in them. So they have double charges, they have overcharges, they have things that, we've all heard the story of the, $100 Band-Aid or the $50 aspirin, whatever, where it's like, whoa, what, why is this so expensive? Um, Sometimes even just the act of asking for an itemized bill will lower the bill because they'll catch them and they're like, oh shoot, we accidentally, double charge them for this or whatever. If it comes back and it's the same, then you get into, and it's annoying that we even have to do this, right? Like that we have to, be little detectives when it comes to medical billing. But a lot of people now are using ChatGPT and AI sources of like, hey, is this medical bill correct? Or there are other resources like Healthcare Blue Book, and there's a couple other, I think, Fair Medical Debt Consumer, something like that. I need to, don't quote me on that, but it's there's a couple of resources out there where you can put in like the CPT codes and you can see, okay, was I overcharged for these things? So that would be step two, is jumping into itemized bills and billing errors and all of that. If you're not eligible for charity care, if the bill is perfect, there's no errors, you can always negotiate hospital bills. And I know that it sounds crazy, but you can absolutely negotiate hospital bills. Happy to dive into like, negotiation tactics and all that, but I'll pause there. Those are kind of like this is, order of operations for me.
Yeah, thank you. Those are fantastic. And I will do the hard work to find out what that fair healthcare or something or another is. And I'll put it in the show notes. You can go to teachmoneyshow.com/podcast and find all the show notes there, or just go to the description of your podcast player and get the direct link to the show notes there. But all those different things that we would want to look at, and going to $4, going to check on the code errors and all that stuff, I'll make sure that those are linked in the show notes. Yeah, I think that, obviously a charity care, like we can't really talk about how you would specifically go through charity care in your specific situation because each hospital has their own way of running the program, right? The looking for errors in the bill, I think that's a huge thing, and then negotiating. So let's talk about those two pieces and what that kind of looks like. You talk about CPT codes. What is that? Why is that helpful? How can we use that to find errors or find things that we can ask them to remove from the bill? What does that look like?
Yeah. So everything on that itemized receipt that you get is going to have a code that is basically like, this is what this procedure is coded as. And sometimes you can, using these tools, Healthcare Blue Book and all that, you can put those in and they will tell you what average costs of that is. And if yours is way higher, you can call the hospital and be like, hey, why was this so expensive? Or sometimes, and I'm definitely not an expert on like CPT codes and all that. There are people that do a lot of schooling and take a lot of tests and do all that. And it's pretty complicated. But most of the time, these things are, they're like ranked as like it's like a tier 1, 2, or 3, like the severity of this, situation at the hospital. And sometimes I think they call it, it's basically like they put it as a higher thing when it shouldn't have been. So, oh, this was not as like, this shouldn't have been categorized as this. It should have been the lower one, which would be cheaper. Another thing that happens, I hear this a lot, is that certain things in the hospital only happen if something else happens. It's like, oh, if you were to go and get a, I don't know, a X-ray, you're going to you're only going to be charged for this if this happened as well. And sometimes you'll see it and it's like they don't match up. And these again are where these like AI tools and stuff can spot differences of like, oh, you were billed for this, but this never happened, which means this didn't happen. Again, it's all very complex. I'm not an expert, but I know, and again, there's like a handful of articles and data that shows like 80% of these bills have some errors or overcharges in them. So it's worth going through it and trying to figure out, what is this a fair bill? So definitely like utilize those tools and ask for it. Again, sometimes I have heard many, many times where you just ask for the itemized receipt and it literally comes back as less. So that, something that's like definitely worthwhile. And again, it's annoying because it's time. Like all of these things take time. And you just got out of the hospital. You have all of these other things going. You're stressed out. You have anxiety about the bill. Like, unfortunately, it's a time thing. Negotiating negotiating is a whole other thing. I'll pause there. Well, anything on the CPT codes or anything like that?
I think that you've talked about the severity piece, and I just want to point out that if you know that, you can actually use that to your advantage by choosing where you get your care appropriately. Like, for example, if you go to an ER, that is automatically, no matter why you're there, it doesn't matter what you went into the ER for. I went into the ER because I had a headache and I needed some aspirin. It's automatically a top tier severity, and they're going to charge you an arm and a leg for walking into the ER. We had our son had a high fever. It was a Sunday night. No one else was open except for the ER. We had to take him there. They said, "Oh, just he'll be fine," basically. Just it's not something dangerous yet. And we got back and we had a $1,500 bill for just like walking into the ER, basically. It was really awful. Uh, but like we were worried about him. We weren't sure, what he needed, so we had to take him to the ER. But knowing that, in that situation, we didn't really have another choice. But knowing that, you say, okay, well, I'd rather go to something that's not an ER because they have like they don't have that automatic, top tier severity piece. And I think that that's one thing that I've learned, that you want to plan that accordingly. Be careful what you say to them when you're like scheduling an appointment with your doctor. It's like, hey, I just, have a question, instead of like, oh no, there's something wrong. Because when it's like a panic, the severity goes up automatically, right? So there are just things that are important to keep in mind with that. But yeah, it is a lot of work and it's confusing. I've tried to do this looking at CPT code thing before, and it's time consuming. So if you don't have the time, then you're just gonna have to pay the bill in that case. So be willing to put in, a few hours working on this if you don't want to. If you don't want to pay that full price that's given to you. All right, that's my piece on that. Now let's talk about some negotiating.
Yeah, negotiations, one, can be really intimidating. I just want to call that out. A lot of times people are like, whoa, whoa, that sounds terrifying. And it can be. Like um it's not it shouldn't it's it's not normal that we have to do this. So it's very uh feels unnatural calling, being like, okay, like what will you take for this? But um there are some really easy low hanging fruit here. One is asking for a settlement amount. So if you have a hospital bill, you can call and just say, hey, talk to the billing department. Hey, I've got this hospital bill. I was looking to close it out. I'm wondering, what is the settlement amount? And all that means is like, if I pay right now, how much will you take? Almost every single time I have ever done this, I have gotten 20 or 30% off the bill immediately. No questions. They'll just give you an amount that's lower. If you got to think, these hospitals, of all of the different revenue models that they have, patient out of pocket expenses is so low. Like they're not collecting a ton of this. They're collecting their money from insurance, from Medicaid, from Medicare, right? So they want to close this out just as much as you do. They want to collect whatever they can. So if you call and say, "Hey, I've got a $500 bill, but I've got $300 and I'll give it to you right now," a lot of times they will take that because they want to close out that account. And a lot of times they will just have an automatic like settlement amount that is, if you pay it, they will take less. A couple things to note on this. You cannot ask for a settlement amount, get the lower amount, and then go on a payment plan for that. You got to pay, you got to have the cash, which is a barrier for a lot of people. So unfortunately, like we all know that stat of like, what is it? 50% of America doesn't have $500 to pay for an emergency. But there are, you can absolutely just call, ask for the settlement amount, and most of the time get a lower amount. If they say no, if they say, "Oh no, we don't do that," I literally will hang up and I will call back next week and I will ask the same question. Hey, trying to close this out. What's the settlement amount? Um, Sometimes they just are like, you got to just talk to the right person. You got to ask for the, hey, I want to talk to the supervisor. You have to be that person, unfortunately, um, in order to get this to work sometimes. Um, a couple other things I want to mention. When you get a hospital bill, you have 1 year until that literally will not impact your life negatively. There is a uh, it cannot impact your credit until it is unpaid for 1 year. Um, so you have time. I tell people all the time, like, you're gonna get all the annoying. I have one right here. Collection notice. You are, and I have been waiting on this because I know I have time. I don't have to pay this right now. They're going to continue. I get a letter every single week, and they're final notice, final notice, final notice. No, it's not going to impact me until it goes unpaid for a year, and then it can impact my credit score. I'm gonna pause there. Anything on that?
I love how they send final notice over and over and over again. It's like the boy who cried wolf. It's not the final notice. You keep notifying me.
Yeah,
Yeah,
it's
yeah. Oh, keep going.
yeah. No, I was just gonna say like it's hard to not be intimidated and stressed out about that because you're like, well, I don't want this to impact my credit. That's like the biggest thing, the biggest mistake I see people do is that they throw it on a credit card. It's just like, oh shoot, like I gotta pay this. This is the final notice. Boom, they put it on a credit card. You would much rather have debt at a hospital than a credit card. Like you don't want credit card debt at 30%, right? The hospital is not going to charge you that interest. They're not, it's going to be less of an impact on your wallet if the hospital holds the debt. So don't be intimidated by that. And again, you have a year until it would actually impact you negatively.
Yeah, that's fantastic. I love these two different pieces. The one, what's the settlement amount? They're just going to lower it almost automatically. And if you're in that situation where you have this huge bill and you haven't been able to pay it, but you've been following some of the other things we've talked about, like contributing to an HSA, if you don't have it in your emergency fund to cover that settlement amount, but you might have it in the HSA, I prefer the HSA as an investment account, but if you need to close out the bill and you're able to with that, that might be a choice to consider. So just keeping in mind that you can pay that settlement amount with those funds as well as needed. And then hang up and call back next week. Some people, when you like some customer service people, they must be new or I don't know, maybe they're having a bad day. They just are not helpful. So like you have to get that right person. I think that was a fantastic piece of advice. And then the you have time thing just it's so nice to know that you have time because I've got a bill sitting on my counter right now. For some reason, our hospital and like different group both sent us a bill, and I'm not sure why, and I still need to figure out why that is. But I'm like, I'm not going to worry about that right now until I have the time to focus on it. And they keep sending me a bill like you need to pay this. I'm like I'll handle that here in a little while when I have the time and the bandwidth for it. So that is something that has really helped me from listening to you before talk about this is I've just been able to calm down. Like we have a year to handle this. So I love those pieces.
I tell people like just want to touch on something you said. Um, Knowing that you have a year, exactly what you said, you can start making a plan. You have a year to maybe save up a little bit of that money to come up with that settlement amount, right? The other thing to note is that medical bills under $500 won't impact your credit score. So that's another thing that is went into effect. So like this whole like medical debt on credit reports is a wild history of just the last couple years, but like there were several things that have happened under the Biden administration and now under the Trump administration that have like changed back and forth, back and forth. So under the Biden administration, they said, okay, medical bills under $500 won't impact your credit score. and it used to be 6 months. So 6 months and it would start dinging your credit. It got extended to a year. Then at the very end of the Biden administration, they said, hey, medical debt, any medical debt won't impact your credit score. And they tried to like squeak that in right at the last second. New administration comes in, they say, no, medical debt does impact your credit. So like we're in this moment of like people still are kind of wondering, like, well, wait a second. Does medical debt, like, how does this work? But we still have those rules that the CFPB announced it medical debt under a year and under $500 won't impact your credit score. So you have some time, you can make a game plan, you can save the money, and then you can start negotiating.
Yeah. I love that. You're just dropping nuggets all over the place. Yeah, I know that the most important nugget is charity care because that's the thing that people really just don't know anything about. But it's you have to take multiple steps to get through this if you don't want to pay the massive bill that's coming in and hitting you, especially when it's just like out of nowhere. You've had an emergency and you feel like you have to pay it right now. There are different things you can different steps you can take, different things you can do to be able to handle that in a responsible way, especially not putting on a credit card, which is just bound to be a
Mm-hmm.
much worse decision.
Yeah, and just like going back to the charity care piece, I think that I mean, obviously, like Dollar Four exists, and we help people, and it's a free service. But there's still a few things to just note is like most of the time, the federal minimum for applying for charity care is 240 days. So you have once you receive that first bill, you got the bill, you have 240 days to apply for charity care. That's the federal minimum. Sometimes hospitals go above that, but just a good date to keep in mind like, hey, I've got some time. Um, and you can apply even if you're already on a payment plan. In fact, if you are on a payment plan and you get approved for financial assistance, the hospital has to refund you what you've already paid on that bill. So, like, you can be in a situation where you're like, let's say you're a teacher sitting at home and you're like, I've been on a payment plan for the last year and I'm eligible for charity care. They never told me. You can apply, not only get that bill waived, but you can get refunded what you've already paid. So, there a couple other things like sometimes hospitals will have special rules around, if you have insurance, it's a different program, you have a different sliding scale, a different income, or sometimes they say, hey, you're not eligible for charity care. Sometimes they'll say things like, if your bill isn't more than $1,000, you can't apply. Sometimes they say, hey, if you're not a resident of these zip codes, you can't apply. I always tell people like apply anyways and write a hardship letter. We have this, we help patients write these all the time where it's just like, hey, this is my situation. You would be surprised how many people just are like, okay, well, we'll approve this application. Um, Another thing that happens is so like you referenced hospital bill because of the birth of a child. So like that's one of the number one reason people reach out to Dollar Four is childbirth. It's expensive. And the other thing is that when you have a child, your household size is now larger, which means you can make more money and still be eligible. So you like another thing to keep in mind is when you are submitting your income verification, if the reason for the medical bill is a child, your income is now able to go up. So you can also write that in your application, like, hey, my household size went up, which means, blah, blah, blah. So there's a bunch of little things, but I feel like our application and process through Dollar Four kind of walks you through that. And it's all free. So feel free to use that.
I feel like my next question is just kind of already answered. So I'm just going to just kind of give a catch-all, final question. Are there any other resources on Dollar Four that you want people to know about? Any other, tips or ideas you want people to be aware of as we're wrapping up this conversation?
I think we have like debt negotiation scripts on our website. If you go to patient resources on our website, we have a lot on debt negotiations. We have a lot on charity care, obviously, and then um, there I we even have social media videos where it's like myself, I'm negotiating live my own hospital bill. So if you want to like watch those are helpful. But I think in general, I just tell people like there's no shame in medical debt, in hospital bills. Like, don't let that get in the way. A lot of times people say, oh, I'll, I don't want to take this away from somebody else, or it's like, see if you're eligible. There's no harm. This has everything to do with a bad system, nothing to do with something that you did wrong or whatever. So I just encourage people like don't be afraid to ask for help. We're kind of all in this. Medical debt is the number one cause of bankruptcy, and it's a huge issue. So that's all I got.
I love it. I love it. And if you guys want to get in contact with Jared and his team and all that stuff at Dollar Four, you can go to dollar4.org, and that's FOR, not like the number four. And if you are listening to this and you are not, experiencing medical debt, if you feel like you have some wiggle room, you can also donate because this is a nonprofit organization that people can donate to. So I encourage you to do that if you are in that position as well. Well, Jared, thank you for coming on the show today. I have one final question for you. What is your number one tip for teachers to have a richer wallet, classroom, and life?
Oh man. Well, I feel like I can't veer off my, I'm just gonna say, uh, like you said, whether charity care is a good idea for you right now or you put it in the bank for later. Like I have helped so many family members and friends get charity care. Like even if you think, oh, that's not for me, it might be for somebody that you know. So like, uh, yeah, equip yourself with the tools and the knowledge to fight these hospital bills because we're being ripped off, people.
I love it. Well, thank you so much, Jared, for coming on the show. This has been a ton of fun.
Thank you so much for having me.
Wow. Wasn't that a great episode? Thank you, Jared, for coming on the show. Now it's time for my clip notes, my top takeaways from this episode. Number one, check to see if you qualify for charity care. You probably do. As a teacher, let's be honest, you are most likely in that 300 to 400% above poverty line range. So double check, especially if you have, a larger household, you're much more likely to qualify. So just keep that in mind. Always, always check if you have charity care once you have that bill. Number two, ask for an itemized bill and look for billing errors. You can do this on your own, or you can use, ChatGPT or some other AI to look over the CPT codes to check for errors. This is a fantastic use of artificial intelligence to make sure that your bill is correct because they make errors. These are input by human beings who weren't there looking at everything that's happening. So they just get a report and they have to decide what was happening and they put in the things. It's just a very complex process to create these bills. So it's not nefarious. It's not like the hospital's trying to overcharge you, but they make mistakes. So always check for those. Number four, ask for a settlement amount. Say this, I'm wondering, what is the settlement amount? You are not being belligerent. You are just asking, what is it? And if they say, we don't do that, hang up and call back next week because you just need to find the right person. The caveat there, of course, is that you do need cash on hand to pay for it. But as I mentioned, if you need to get this closed out, the HSA can be a powerful tool to do that if you have an HSA. Of course, don't rely on the HSA if you don't have to, because we want that to keep growing in your investments. Number five, you have time. 1 year after the hospital has sent the bill, that's how much time you have before it impacts your credit. So don't rush into this. If you need to save up to pay it off to get to that settlement amount, save up over that year and then pay it off. Don't feel like you have to do it tomorrow, and don't put it on a credit card. And number six, medical bills under $500 won't impact your credit score. I thought this was another important tidbit. If you are really struggling, keep that in mind. There are all these little nuances and pieces. I didn't write them all down, but just remembering that there are nuances to the law that are in your favor. So don't let the hospital bully you. Don't let the fear of your credit score going down hurt you. If you need to, keep your debt with the hospital instead of putting it on a credit card because they're going to be much easier to work with. So those are my top takeaways. And I think just one more thing to keep in mind is I know that a lot of people listening to this are already financially minded, if you are able to donate to organizations such as Dollar4 or others that are helping people, I encourage you to do so because generosity is the way that our soul can grow as we grow our net worth. And of course, I know that you already have the heart for that because as a teacher, you are already rich. Your wallet just needs to catch up. If you would like help on your personal financial situation, go to teachermoneyshow.com/coaching and you'll be able to find different ways I can help you there. If you would like to participate in spreading this message of financial empowerment to teachers, I would encourage you to talk to your administrator or to your district level about going to seankmorgan.com to find more information there. And regardless of which one of those you need, please like and subscribe so that way we can spread the reach of this more. Leave a 5-star rating and review. That's going to help more teachers find this. And then turn around and tell a teacher friend. I really appreciate it.
Contents of this podcast are informational in nature and are not legal or tax advice, and neither I nor my guests are engaged in the provision of legal, tax, or any other advice. You should not act upon this information without first seeking appropriate advice from an accountant, financial planner, lawyer, or other professional.